Hi viewers, I'm Arun Gopal Krishna. Today we are going to discuss about prostate related issues. Let me tell you that today we will not be discussing about prostate cancer. We'll have a standalone Facebook live session for that. But today we'll be discussing about prostate related issues. As a man gets older, his prostate becomes larger. We know that that talking about your prostate can be a little uncomfortable. You might not know where or what it is, or you might have only heard about it, about older men having difficulty in peeing. We have got all the details about what your prostate is, where it is, and what it does. We will discuss how it might change as you age, and any changes or symptoms you should keep an eye on and discuss with your doctor about. Let us welcome Dr. Griffin, a renowned urologist, andrologist, and kidney transplant surgeon at VS Hospitals. Dr. Griffin is a pioneer with an experience of several thousands of surgeries to his credit. And today, Dr. Griffin will educate us on prostate-related issues. Welcome, Dr. Griffin. Great to have you with us.
Thank you very much, Arun. First, I'd like to thank VS Hospital for this wonderful opportunity. Let's go on to the topic.
Dr. Griffin, my first question, what is prostate?
Yeah, see, prostate is basically a male reproductive organ. It is there only in the males. Females do not have this organ. It is a male reproductive organ. It is of the size of a walnut, and it is located below the neck of the bladder. That's where the urine pipe starts, where the internal mouth of the urine pipe starts. The external mouth is opening outside. So the internal mouth, where it is attached to the bladder, the urine pipe, or surrounding that pipe, there is an organ called prostate. This is a male reproductive organ. Its function basically is for reproductive function, and it constitutes a lot of components which are there in the ejaculate, that's semen, which we call semen. So most part of it is from the prostate. So this is the organ of importance. It is the other use of this prostate gland is basically for continence. Continence is urine control. So prostate is a very vital organ for males. And that's about the prostate gland. Yes, sir.
Thank you, doctor, for educating that. What are the common prostate problems, Dr. Griffin?
Okay, yeah. Coming on to prostate, see, it's all basically age related. So like any organ in our body, prostate gland also can undergo any infection or inflammation. So infection is commonly seen in the reproductive age group. Infection of the prostate, we call it as prostatitis. It can be acute or chronic. Acute is when sudden infection happens, patients will present with fever and other acute severe symptoms. And chronic is when the same condition is of subclinical, very slow or indolent course, wherein patients are not bothered very severely, but they do have some nagging symptoms. So these are all the infections of the prostate. In addition, sometimes severe infections can lead to pus development with the prostate also. That is called prostatic abscess. These are particularly seen in diabetics and immunocompromised individuals. And apart from infections of this prostate gland, the prostate gland also can undergo hypertrophy or growth with age. So the unique property of this prostate gland, as Moses, this male organ, it has a capacity to grow throughout life. When we grow as an adult, all the organs in our body, like liver, spleen, lungs, all of them attain a certain size, and they do not grow beyond a certain size. Whereas the only organ in our body, particularly in the males, is the prostate organ, which grows with advancing age. That's why with advanced age, a lot of elderly people we would have noticed having urinary trouble and issues because of this prostate gland growth impinging onto the bladder and the urine pipe, causing a lot of other issues. And another issue, common issue which we see nowadays with increased screening is prostate cancer. So it's the second most common cancer in males. And India is also, we are also picking up, and we are also getting on to that high-level prostate cancer territories. Unlike the Asian Africans who used to have it earlier, Indians are also having early prostate cancers, which are pretty high grade, which can easily be diagnosed early. So these are the basic presentations of different diseases of the prostate gland.
Thank you, Dr. Griffin. Dr. Griffin, what causes prostate?
What causes the prostate?
What are the causes?
Causes of various. See, as I said, basically, in the main lifestyle related changes itself can lead to all these infections and growth. Smoking, obesity, all those things can lead to hyperplasia and growth of the prostate gland. And another important factor for this prostate related issues can happen in families. So if you see some of them, when they come down, they will be saying like, if you ask the history particularly, they will reveal that yes, my dad underwent a surgery for prostate, or he's on medications for prostate. Or if you still further, some of them can still recollect and say that, yes, my grandfather did have some urinary difficulties for which he was on some treatment, which I vaguely remember when I was a child. So if a grandfather has a prostate related issue, it can run onto the son and up to the grandson also. For example, if a grandfather has only a daughter, and if that daughter has a son, grandfather's genetics can be transferred on to the grandson also. So he can also present the prostate related issues. It's not like 100%, but yes, they do tend to have prostate related symptoms. So these are the various causes for it.
Thank you, Dr. Griffin. Dr. Griffin, who develops prostate?
Yeah, as I said earlier, with the advanced age, the prostate definitely grows in size. So, as I said, it's a unique organ. It has got that capacity or ability to grow throughout lifetime. Unlike women who after menopause, the uterus shrinks and they will not be able to conceive. Males do have the potency. We might have read in various articles of how a 70-year-old or 80-year-old has fathered a child. So the organ has got its potency. So it just keeps growing in age. And also because of various hormonal changes, particularly with old age, the prostate tends to grow a little faster in gentlemen. And to give you statistics, men in 40s, if you see only 8%, that is out of 100 men, or a 40-year-old, 100 men, if you just collect 40-year-olds, and among the 100, only 8 will have prostate-related issues. Whereas with advanced age, in an 80-year-old, for example, 80-year-old men, if you have 100 people around of 80-year-old men, close to 80% will have prostate-related issue. So that is the frequency with which prostate affects the geriatric population, all the elderly population. So another thing is, it's also 60% in 60-year-olds. So if you look at it, maybe if 60%, 1 in 2 individual, almost more than 1 in 2 individual will have it above 60. If the father or your father-in-law can have a prostate-related issue, or if you're above 50, definitely you yourself can develop. So we need to be aware and know that fact that it's a disease of the aging male. With our life expectancy increasing, with all modern medications, many of us tend to have this prostate-related growths also.
Thank you, Dr. Griffin. Dr. Griffin, what are the symptoms? Can you throw some light on it?
Yeah, symptoms. Basically, this is one very important organ. See, symptoms. Many of the men are very, very silent sufferers. This disease, I would like to say, deeply affects the quality of life. Because most of our patients, when they come down, many of them, for example, many of them will be officials or high bureaucrats. They will be saying, like, because of my frequency of urination, I am not able to go up the ladder. I'm giving up a lot of opportunities. I'm not taking over responsibilities because of this issue of mine. Many of them will be having a diaper on and they will be convening meeting and they will suffering in silence. And this will cause them too much of depression and they will not be able to live their life fully. Many of them, of course, those who are socialites also will not, socialist, active persons also will not be able to mingle with friends. They will not be able to attend parties or stay overnight at another place because of this basic issue. And even many of them used to say that I have avoided overnight travel just for the reason of this prostate related issue. So it does tend to affect our individuals very much mentally, basically, psychologically, it does affect very much. And coming on to the symptom profiles, what happens is, as I said, this prostate organ, it is of the size of walnut. It is like a donut, basically, something like a donut. And there is a central hole through which the urine pipe goes across. So when this prostate enlarges, it can compress and squeeze the urine pipe. So two things can happen. One, we call it storage related symptom. Storage. See, all of us tend to store urine in our bladder. Our bladder is something like a balloon. It can store urine, it can relax receptively, and it can hold on water for quite some time, of fixed period of time. And then we can once we find a socially acceptable place, we will be going to the loo or restroom and then empty the bladder. So that storage function of the bladder is affected deeply by this prostate. So what happens is patients tend to have increased frequency. The bladder will not be able to store urine. So they will be frequently visiting. They will be in love with their restroom. They will be frequenting it very often and will be there emptying. And this urination also will be very low volumes, and it won't be a very high, good volume flows. And this frequency will, particularly in daytime as well as in nighttime, a normal person is allowed to pass up to 7 times. On average, normal person is allowed to pass up to 7 times during the day, and in sleep you should not wake up even once. If you wake up even once in sleep, that is called nocturia, and nighttime urination, we call it nocturia, nighttime urination. So these nocturia episodes also can lead to accidental fall and fractures, particularly in this elderly males, because international statistics say that commonest cause for all these bedtime falls and fractures and hospitalization, and it leads to a big cascade of events in these elderly gentlemen because of this simple problem of prostate. So this is main thing with the storage related issue. Also, they can have urgency. That is, once you have your bladder is sensing that there is urine there, we will be, a normal person will be able to hold on the bladder for some time. Whereas gentlemen with these prostate related issues will not be able to put away that desire, and that compelling urge or that desire, they will have to answer it immediately. Otherwise, they might leak urination, or they will be into a lot of stress. So that they will have to stop a meeting and then they have to cut across and go to the restroom and find a place. If they are in travel, still worse, they will have to ask the driver to stop the vehicle and get down. They're using a public transport, and that's the reason many of them avoid these public transports as well. These are the storage related symptoms which I said. Coming on to the voiding related symptoms. Voiding is when you pass urine. So what exactly happens once you get the sensation to pass urine? A normal person visits the loo and he will start urination without major delay as soon as you enter the loo. But these gentlemen with this prostate issues, the urine pipe is squeezed by the prostate and they will have hesitancy. We call it hesitancy. They will not be able to start urination. So that's the reason why when you go visit a public toilet in a theater or they will say, do not stand behind the elderly gentleman, always go behind the younger gentleman. That's the reason behind it. So they will have hesitancy. They will have difficulty in starting the urination, and the urine flow will be slow. It will be a thin stream. Unlike of younger age, when the same patients used to say, when I was younger, so I had a good stream. I used to stand well away from the commode. I used to pass urine. The good aim. I used to aim my urine and pass. But right now I have to go closer to the commode and it drips down. And at times I will have to strain or I will have to push to start my urination, unlike olden days. So this is basically with the initiation, and that urination also, the flow will not be consistent, and some of them will have an interrupted flow. The flow will be stopping, starting, stopping, starting multiple times. It won't be a continuous flow. So in addition, many of them will also complain of post-void dribbling, dribbling of urine basically, and the undergarments might get wet once they finish urination. And some of them will say that the bladder is not empty at the end of urination. So they will say that I felt that I passed urine, but there is still something left inside. So we call that post-voidal residual urine within the bladder. So many of them tend to have that residual urine inside. So that residual urine can form a nidus for bacteria and infections. So that can also lead to recurrent urinary tract infections in many ways. So they can present with dysuria, we call it burning of urination, or fever. They can have lower abdominal pain at the region of the bladder, and they can also have blood and urine at times as well. So these are the main symptoms, the storage symptoms and the voiding symptoms, which are common in prostate. Yes.
That was very elaborative, Dr. Griffin. It was very easy to understand. Dr. Griffin, what are the complications can prostate lead to?
Yeah. See, if, for example, a gentleman is not emptying himself well, he is having residual urine because of this prostate-related issue. Then that residual urine, see, if there's a wash basin which is having stagnant water, the room gets stinky, right, in a day or two. Similarly, if there is urine inside, and it's all toxic fluid inside, and if you're not able to empty yourself well, they can gather bacterial infections within the system, and that can irritate the bladder and cause something called cystitis. And at times, the infection can climb up to the bladder, up to the kidney, and lead to pyelonephritis, so this infection of the kidneys, and it can be at times life-threatening as well. And the other issues is when this stagnant urine is there, there is always risk of stone formation as well. And this stagnant urine present in the bladder can get refluxed into the kidney. It's something like the tank is overfull, so there is no outlet. So it just goes back to the origin, to the kidney itself, and thereby causing damage to the kidney. And people have presented to us with kidney failure, warranting temporary dialysis to get them out of that situation, and then finish off the prostate procedure and then make them as a normal individual. So prostates can present in a wide way, and some of them will present also with bleeding in urine, and they can lose quite a lot of blood in urine as well. So these are the common issues with something called benign prostatic growth with age related. Unlike the cancer, that's a different topic, as you said. We will have it for another day.
Thank you, Dr. Griffin. Dr. Griffin, how do you treat it basically?
Okay, coming to treatment. Before treatment, let me just say how to diagnose it first. That is more important for us. So when a gentleman comes to me, first what we would like to know is, I would like to know his quality of life index, the bothersome index, how much he is affected because of this prostate, what is he undergoing because of this symptom, and that symptom leads to a lot of difficulties. And then once I know the category of his ailment, what is this bothersome score, I would like to first examine. That's what I will be doing after getting the deep history. The examination, we will look at the bladder. Basically, we will press onto the lower part of the tummy and check if the bladder is distended. Some of them will say, doctor, I just went to the restroom, I passed urine, but you're saying there is some amount of urine which is palpable in the bladder. That is because the tank is empty. Whatever urine they are passing is it is called overflow incontinence. Just because the tank is full, they will be passing only 50 ml or 60 ml, but they will be close to 2 liters or 1.5 liters at times, which is stagnant inside. We call it chronic retention of urine. So those also can lead to a lot of issues in such gentlemen. So we need to basically see what is there clinically, and if there's no bladder, then we will do something called digital rectal examination, wherein we will palpate the prostate gland and feel with our fingers whether it is a soft gland or whether there is any infection, or if there is any cancerous changes. When cancerous changes, there will be hard areas and asymmetrical growth of the prostate, or very rapid growth of the prostate. So all these things can be easily picked up by your clinician or the urologist who's examining the patient. Then we will, once we see clinically what they have, we will get a simple ultrasound. Bedside scans are available. Ultrasound scan is available everywhere. So once the ultrasound is done, we will know what is the status of the kidney tubes, the bladder, and the urine pipe, and the prostate. So we will get within a couple of minutes, we will be able to screen them completely. And also we will ask for specifically post-void urine estimation, wherein the patient has to check what is the bladder capacity, how much urine is there in the bladder. Then we will ask the patient to go to the restroom, pass urine, come back for a post-void residual estimation. So if the normal person should empty the bladder completely, but prostate-related patients who are suffering because of the prostatic obstruction tend to have a lot of residual urine. So some of them also present with acute retention, wherein they will say, I've got lower abdomen pain, doctor, I don't know why, but I'm not able to pass urine for 6-7 hours. I've been drinking close to 1.5-2 liters of water, but nothing comes out. A few drops only go, and there is severe pain. That is called acute retention of urine. So if that is a situation, we may also have to put in a catheter temporarily and drain out that urine and then treat them and get them out of that episode of retention. So to diagnose this, we will need ultrasound scan, which is a very, very important tool for us, easily available. Next, we will also check the urine routine and the culture. So the urine routine and culture will give us information regarding whether there is any superadded infection of that stagnant urine and whether there are any blood cells, pus cells present or anything, and then maybe we can direct our treatment towards it. And the next treatment will be PSA. Investigation will be PSA. We call it prostate specific antigen. Like for every organ, there is a test. Like for liver, we have liver function test. For your thyroid, we have thyroid function test. Similarly, for prostate, we have a very economical test called PSA, prostate specific antigen, which is a very important test. It can give us information about the nature of the prostate. If the PSA values are very high, it can denote prostatic cancer as well. So we are nowadays the master health checkups have made PSA mandatory for men above 50. So it's always good to get the PSA screen. Because of that screening, we are able to pick up these diseases early, and we are able to address the disease when at infancy, when it is at the organ level itself. Earlier, what used to happen was patients used to present in a metastatic or stage 4 disease, wherein the cancerous tissue have gone out of the prostate to different organs. And in such scenarios, we will have to manage them in a different manner. Whereas this PSA screening has helped us in identifying the disease early and treating it early so that we can get them out of harm's way and help them in leading a very healthy and normal life again. So this PSA and another test which we have to do is called uroflometry. Okay. So what we do is when the patient is there, we will ask them to pass urine into a machine. Basically, it's something like a commode, like a Western closet commode. So when they pass urine into that machine, that computer graph is generated based on the urine flow speed. If the computer graph shows a good pattern, call it a bell-shaped curve. If it shows a good pattern, then we will know that it is not an obstructed prostate or obstructed system. So the patient is able to pass urine normally. Whereas in an obstructed patient, the flow will be very thin and flat-lined and slow. So once we look at the graph, we will be able to decipher what stage the patient is in, and we will also know, okay, you'll have to be careful. So you need to be more vigilant. You need to travel plan your travels accordingly, and you need to take help from nearby medical centers if at all these symptoms arise. All those things it will be easy for us to counsel and explain to our patients. As well as these investigations will help us in following them up also. So these questionnaires and scans as well as the uroflometry can help us in following up our patients to know how they're improving on these aspects as well. So these are all the investigation modalities which I was telling you. Coming on to how to manage, which you asked me. So management is pretty simple, wherein we will look at what type of prostate, the size, and then we will either prescribe them a simple medication. It's called alpha blocker. This medication will widen the urine pipe. So the prostate is basically something like a round donut, and urine pipe is going across. The pipe is going across to the center. So what we do is we will give a medication alpha blocker to widen this urine pipe, the urethra. So that will lead to a wider channel so that urine goes freely. So this is called alpha blocker. The other medication which is available is we call it 5-alpha reductase inhibitor. So those tablets will shrink the prostate. So our aim is to once we shrink the prostate, it moves away from the urine pipe which goes through the center. So we will get additional passage for the urine to go freely downward. So these are the two medications which we start. And some of the prostate patients present with erectile dysfunction, erection-related issues. So for them, we have a phosphodiesterase inhibitor. So based on what category our patients lie in and what are their bothersome symptoms, we need to channel the treatment accordingly and then give them those medications. If these medications are not working in a gentleman, as we serially follow them up, if they are not improving and or if they are presenting with a complication, like as I said, a kidney failure, warranting dialysis, or stones which are causing disease, or recurrent bleeding because of prostate, or recurrent urinary tract infections because of this prostate, then they will start, straight away go into the category of surgery. They will be qualified for the surgical category. Gone are the days when they used to open up the tummy to remove the prostate. Now we just pass in a simple camera, something like a pen type camera, to the urine pipe, and we will visualize how the prostate is. And endoscopically, we can clear the obstruction and alleviate the symptoms and make the aperture wider, so that they can live a normal life without any difficulties. So this is called TURP, transurethral resection of prostate. So these are the various ways: medical management and surgical management, which is endoscopic. It is not any surgery. We don't cut open. There are no sutures involved. It's through a complete endoscopy. These are the ways we manage prostate.
Thank you for clarifying in detail, Dr. Griffin. Dr. Griffin, what are the side effects of treatment during
side effects? Yeah, as I said, the alpha blockers and medications is a they've got excellent profile of safety, because basically this prostate is a disease of old age. So the medications do not have any major side effects as such. If you look at it as a side effect, what exactly happens is sometimes the retrograde ejaculations can happen, because once the urine pipe is widened, sometimes some men might say that the ejaculation is a little bit on the lower side because the pipe has been widened. It's something like when water flows through a thinner pipe, the force is better than a wider pipe. That's why it is effect of the drug, and people might have a dry ejaculation. They need not get worried. It doesn't stop their function of fertility, but it is just a temporary phenomenon which happens due to this tablet, and they did not get worried. They can live their normal life. They can be sexually active as well without any. Apart from that, medications do not have any major side effects. They are basically designed for elderly people, those who are cardiac, those who have undergone bypass surgeries, those who have got a stent, cardiac stent, or those who have stroke or any cancers. Anyone can have these medications without any major interactions or any side effect. Surgery, of course, yeah, the side effect with surgery can, like any surgery, a risk of bleeding, or any clots for passage, and that will be a temporary phenomenon which will become all right. Like if you have a scratch anywhere, we tend to have some amount of ooze or blood from the skin unless we heal that region. Similarly, when we internally finish off the surgery, there might be some drops of blood and stuff which can slowly evade with time. Yeah.
Thank you, Dr. Griffin. Is it possible to prevent prostate-related problems or growth of prostate?
It is not, sadly, no, there is no solution to it. It's like whether we can prevent graying of hair. So we cannot prevent graying of hair. With the age, it's a phenomenon. We are destined, we have to go through it. Similarly, this prostate-related enlargement is bound to happen for men above 50. But we had to just say our prayers well that we are not in that 50% who get affected. So otherwise, even then, we can check ourselves, screen ourselves well, and make sure that we can sort of keep the disease under control and keep correct medications going, so that we don't land in an emergency like kidney failure or stone formations or other things, residual urine leading to recurrent urinary tract infections. All those complications can be prevented by taking medications and keep ourselves safe. So we cannot prevent it, but having good hygiene, good diet, and proper hydration, drinking adequate water, avoiding alcohol, smoking, and late night alcohol particularly can act as a diuretic and aggravate the prostate related issues. So, and some patients might be taking over the counter cough syrups and cold syrups and all. They do have some antihistamines within that also can aggravate the prostate related symptoms. So always consult a physician before taking any medications, stating that whether you have any urinary issues or whether you are on any medications, and then take it forward.
That's great, Dr. Griffin. Dr. Griffin, what happens? Oh, I'll come to that question later. Does lifestyle modification like eating, diet and exercise helps in prostate?
There is no specific diet. Yeah, diet. There's no specific diet. Of course, normal diet, avoiding spicy diet and dairy. There are some papers which suggest that dairy milk products, starch, avoiding high glycemic, high sugar containing diet can lead to prostate-related cancers. It's general for everyone. Like obesity and all this high starch-related can cause prostate-related issues, like any other organ. So better to have a good green balanced diet, nutritionally well-balanced diet with a lot of green leafy vegetables and a lot of antioxidants and fruits which are rich in antioxidants. All those things can help in having a healthy bladder, and also planning your liquids properly, drinking proper liquids. Those who suffer from prostate related issues should try to avoid nighttime or bedtime liquids. In our society, basically most of our elders, when they go to sleep, they tend to drink a lot of water, cup of milk or water, any form of liquid before sleep. So that should be done away with, because the fluid which they take, for example, if someone sleeps at 10 o'clock, if he drinks a cup of milk at 10, that can wake him up for urination in the middle of the night, maybe at 12 to 1 o'clock. And what exactly another mistake our elders do is, once they visit the restroom and they come back and they drink plenty of water again. So that will again contribute to nocturia or nighttime urination or nighttime frequency. And they may wake up another a couple of hours later for another void. So their nighttime sleep is also disturbed. As well, they will have a lot of chances for accidental falls and fractures, particularly in that dim light wherein our physiology is also not very well tuned. And a lot of events can happen during that time. So ideally, those who have prostate related issue, try to avoid bedtime liquids and have a proper liquid during the daytime. You can have adequate nighttime. These are the basic things.
Thank you for the advice, Dr. Griffin. Dr. Griffin, what happens if prostate related issues are not treated on time, and where it leads to?
Yeah, as I said, okay, this also we had discussed. So if we don't treat it on time, we can have the gland can keep growing in size, and the residual urine can keep increasing, and it can lead to recurrent urinary tract infections. Sometimes what happens is many of our patients will be constantly taking a particular antibiotic prescribed by a physician for maybe a mild burning sensation or a mild bloodstained urine, and they tend to continue the same prescription every time they have a similar episode of urinary infection. But the cause is different. They're only treating the effect. They're just self-medicating or treating themselves for the urinary tract infection. So every time they take a medication, the residual urine is sterilized by the antibiotic. That medication acts for that time, and subsequently the same stagnant urine tends to be there, and fresh bacteria grows over the due course of time. So what we need to do is make sure that the outlet is good, and make sure that they pass the urine completely and empty the bladder well, so that there is no residue inside, and that way they can try to avoid all the complications. If the medications are not continued, as I said, then next is hematuria. One is recurrent infection, second is hematuria, bleeding from your urinary passage. Chance of forming stones within the residual urine is also there, and kidney failure. We tend to see a lot of kidney failure because of a very simple organ like prostate, which can be easily tackled. So these are the things which happens.
Thank you, Dr. Griffin. What is your take-home message?
Take home. Yeah, before that, I thought I will share my screen, Arun.
Yeah, sure.
Shall I? I'll just share and I'll just show a few
Maybe
slides.
Dr. Griffin.
Screen. So just to finish, so as I said, I just thought I will finish it off with the overview. As I said, the frequency at night time and daytime, urgency, need to urinate frequently and immediately, hesitancy, the flow doesn't start right away, it takes some time to start. Intermittency, as I said, the flow stops and starts several times, and there's a thin or slow flow of urine. It takes a lot of time for them to finish the urination. Blood and urine, feeling that the bladder is not emptying well because there is residue inside. And there is post-void dribbling, wherein they continuously, after finishing urination, when they walk back to the restroom, once they're dressed up, they find that their undergarments or their pants is wet with the urine. This is because the urine from that urinary tract is not squeezed back into the bladder because the prostate is blocking that. So that can happen, and erection-related issues like or painful orgasms can happen. These are all the symptoms with which are prostate-related patients present. And this picture, as you see, you can see that this is the bladder. I'll be sure removing my cursor. The bladder is here, and you can see the urine tube. This is the internal opening of the urine tube. This is called urethra. That urethra flows through the substance of the prostate. This is the prostate gland, right lobe, and this is the left lobe. So the urine pipe is growing through the center of the prostate. As I said, like a donut.
Yeah.
So the prostate is like a donut. So when this gland grows, if you see to the right, and this gland hypertrophies, when it grows, you can see a lot of nodular growth in the prostate. When this grows, it squeezes the pipe completely. And this, because of this squeeze, the residual urine within the bladder is always present, and they are not able to empty themselves well, and they suffer from all the symptoms which we had already discussed. So, as I said, the urine flow from the bladder into the prostatic urethra. We call that prostatic urethra, this junction, and it crosses towards the penis. So, the prostate is a very important organ, which is causing that obstruction. And here, as I said, a simple ultrasound scan, we can gather a lot of information about the kidney, the urethra, the prostate, and how much urine is left behind, whether there is an infection, whether the residual urine has got any floating debris or muck inside, and whether the kidney is also swollen, whether there's a back pressure or backflow of urine from the bladder towards the kidney. All these things can be gathered in a quick, simple test. And this is the Uroflow test. As I said, like if you look at the graphs, here's a good volume graph wherein the patient will be able to pass up to 20 to 25 ml of urine per second. The graph, this is how a normal graph should look. It should be looking like a bell. That's called a bell-shaped curve. So unlike if you look at some gentlemen, they may have interrupted curve, stops and starts, then stops and starts, then stops and starts. So it's not a good volume flow. The intermittent flow. They will have to squeeze or strain every time using the tummy, using the abdominal muscles, and only then the pressure inside the bladder increases and momentarily urine comes out. Then the prostate closes the urine again, the urine tube again. So that is called interrupted curve, and then there is a plastic curve, a slow, thin stream going through the prostate. So these are also present. These, depending on various curves, we'll be able to find out what they have. And this is a simple test called flexible cystoscopy. We call it office cystoscopy, wherein it's a very thin camera, flexible camera. It's just passed within the urinary pipe, and as you see in this picture, you can see the bladder from below. So you can see the bladder, the passage is completely clear. There is no prostate. These are the prostates, right? And the left gland. Whereas here in this image, if you see, I'm not able to see the bladder because both the lobes have squeezed the pipe completely internally. So this is when your patients will start having trouble. So basically, I will just show you one more if I have time.
Yeah, sure.
This is an endoscopy showing large occlusive in an elderly gentleman who was post-bypass surgery. He was on ecosprin tablet. If you see, the prostate is blocking both the sides. And as I enter bladder, you can see a lot of muck and debris and pus floating inside the bladder. Because of recurrent infection, you can also see blood within the system. So hematuria, as I said. As I come back again, the prostate is completely occluding. So also, if you see, the bladder musculature is also got crisscross fibers there. We call it Ejaculations. It's weakened basically. And this is the hot loop. This is the TURP surgery wherein we use that hot loop which will trim the excessive prostate which is growing inside the urine pipe. So this prostatic surgery, it's called TURP. As we cut, if you see the hot wire loop will basically seal off the blood vessels, and there will not be any major bleeder and no blood transfusion will be required. This gentleman was on eposprin and clopidogrel, which are all blood thinners for his heart related ailment. And this is another procedure called vaporization of the prostate, wherein it's an excellent procedure wherein you can just vaporize the prostate. You can see the prostate melting in front of us in no time. So as we do this procedure, the whole organ moves away from the center so that there is a nice wide lumen which can be created because of this prostate within no time. And this is all done under anesthesia. If you see the completion now, you can see the bladder from below. And the camera is also easily going across and coming down compared to how it was initially as shown in this video. So this has to be done at the end of the procedure. If you see this gentleman is able to pass urine completely. He's under anesthesia. He's not straining to pass urine, but the flow is adequate and complete. This is because of the adequacy in creating a channel by this procedure called TURP. So, yeah, I think if there are any queries, can we take any queries?
Yes, time? Doctor. Yes, doctor. Yes, doctor. One second.
And about prostate cancer, few words. PSA is a very important test, as I said. We need to screen annually for men above 50. So if the PSA is going on the highest side, we need to screen quickly get them. For men above 50. So if the PSA is going, we need to screen annually for men above 50. So if the PSA is going, we need to screen for men above 50. So this is sorry, I'm not able to. The voice, sorry, sir, the voice is not very clear. I'm not able to gather the question.
Is it audible, doctor?
I didn't. Could you gather the question for me, Arun? I was not able to receive it properly.
Is it audible now?
Yeah, it is clear. I can hear you clearly.
Yeah.
But I was not able to listen to the audience who had asked the question.
Dr. Griffin, there is one viewer who is asking, like, at what age should you have your prostate checked?
Prostate check, that's what men above 45 can definitely go for a prostate screening. If particularly your parents or your grandparents father or grandfather has had that issue, so earlier the better. Plus, if you have all these symptoms which we have described, even one or two of the symptoms which is bothering you, you should not suffer in silence and wait for the complications to occur. It's always better we start our treatment process early so that we can easily get out of the problem. Even once, if you check if you're in that category of mild symptoms, we can put you on only a watchful waiting strategy, wherein we will not prescribe any medications or anything. If you're in that safe zone, you can just observe. Annually checking yourself once a year is enough, but above 50 definitely you need to keep checking yourself. It's a part of master health checkups. Simple economical test, PSA is added there. Ultrasound as such, it comes in all the master health checkups. And uroflometry, if you feel your flow is not very complete and of good desired speed, you can go for it. All these can be done in like a couple of hours. Everything can be done, and we can diagnose and put them on medications if required. We do it as like in the prostate clinics everywhere. It is done. Most of the cities do have the urologists, Endo-Urologists who are able to put all these tests and come to a conclusion and give you a solution within a short period of time.
Thank you, doctor. Doctor, one more question for you. How can you prevent a recurrence of BPH?
Recurrence. Usually, I think the question is for post-surgical recurrence. That's what the viewer is asking. So after a TURP surgery, which is adequately done, patients will not have a recurrence because it takes a lot of time for the prostate to grow. It might take a couple of decades at least. So it doesn't grow because we go up to the zone. There are various zones in the prostate. So there's a transitional zone and then there's a peripheral zone. Once the transitional zone and the periurethral zones are adequately removed, most of them might not have a recurrence, but sometimes some apical lobes or nodules can creep up. If it is causing trouble, then we can easily manage it with medications. If not, we may have to do a flexiscopy and check whether there is a recurrence and then proceed. So recurrence also, one more thing which we need to keep in mind is if you have prostate related symptoms persisting even after your endoscopic surgery, you need to be wary that still prostate cancer can also be a possibility, because in endoscopic surgery we will not remove the full prostate. It is like an apple, we are coring through the central part which is blocking. So there is still some amount of residue around. So those residues also can change into cancers if you have that genetic tendency to form a cancer. So you need to also keep checking your PSA levels and your residual urine volume and other parameters. Multiple parameters are needed to check. Otherwise, prevention, you can just continue with glucostride or the 5-alpha reductase inhibitors, as I said earlier, which will shrink the prostate and can keep the prostate at check, keep its growth at check. Yeah.
Thank you, Dr. Griffin. One more question. Is enlarged prostate curable?
It is very much curable. Depending on, as I said, sometimes prostates, not all prostate, and that's another myth, not all enlarged prostates have to be operated, because I have got patients with almost close to 150 cc of prostate still on medical management, and I've also had patients with 30 cc prostates presenting with retention. So sizes doesn't matter over here, because it all depends on where the prostate grows. If the prostate is growing centrally towards a urine pipe, it will cause a lot of issue. If your prostate is growing peripherally, outwards, not towards the central urinary pipe, if it's growing outwards, then it is definitely not going to compress or squeeze your urine pipe. So just because your scan says you got a big size prostate, you need not undergo a surgery. You just have to, there are a lot of parameters to look into it. That's what, as I said, there are a lot of questionnaires, International Prostate Symptom Score questionnaire, then we've got the scan, we've got the Uroflometry. So once we look at it holistically, we will know whether this gentleman needs anything at all. So we have patients with 200 cc and all living comfortably. They will, so size is not a major criteria for us to take a decision on surgery straight away. It is a symptom.
Thank you, Dr. Griffin. There is one more question. Can you have an enlarged prostate without cancer?
Yeah, it is. As I said, prostate's got many zones. So as I said, there's a central zone and there's a peripheral zone. So the central zone is one which we call it benign enlargement. That is called BPH. Benign is non-cancerous. BPH, this is the commonest. As I said, 80% of men or 80-year-olds are having this benign prostatic enlargement. So if your grandfather is there, if you check, if you do an ultrasound scan for them, they will be having an enlarged prostate. Are everybody affected? No. Some of them who are affected because the prostate goes inwards and squeezes the urine pipe. Only they will need attention. So you might have noticed not every 80-year-old will need a surgical intervention. So it does tend to grow. So you just have to keep watching if it causes trouble. As I said, if you have the urgency, hesitancy, intermittency, frequency, as we discussed throughout, if any of these symptoms are creeping up, then maybe that's a time for you to check the prostate and take it forward.
Dr. Griffin, there's one more question for you. I think the last question from a viewer. What are the other problems that can affect the prostate?
Other problems, as I said, yeah, we have infection, as I said, prostatitis, acute prostatitis, chronic prostatitis. These are all basically seen in sexually active young men, basically. And there is another condition called chronic pelvic pain syndrome, wherein this chronic prostatitis can be a nagging condition, a mild infection which will be refractory and sometimes non-infective causes of inflammation of the prostate. Basically, these are all medical terms, complex terms, which can also, they are not florid infections per se, but they are very mild inflammations which will be causing major trouble for our patients. So there are a lot of methods for treating such chronic prostatic symptoms as well as acute symptoms. These are all prostatitis disease, as I said. The next is that abscess, wherein the chance of pus formation within the prostate, wherein the whole substance of the prostate becomes affected and sloughed off. Because of paucity of time, I thought there is another video on prostatic abscess surgery also. I think we are running short of time, so I'll not
Yeah.
showing it.
Thank you, Dr. Griffin. So viewers, if any elders watching this awareness, please don't hesitate to consult your trusted urologist. And if any youngsters watching this, please educate your elders, your father, uncle, anyone, so that they can get treatment on time. And Dr. Griffin, thank you so much for your patience, and thank you for that videos which you elaborately briefed us. And it was a very, very educative session today. Thank you so much for your valuable time today. And coming Thursday, that is 27th January at 8 p.m., join us for a Facebook live session with one of the finest and renowned surgical oncologist, Dr. Sarvanan Periyasamy at VS Hospital, Chennai. Till then, take care. Thank you.
Stay safe. Omicron is catching up. So wear your mask and get yourself vaccinated.
Yes, doctor. Thank you so much.
Bye-bye.
Bye. Thank you.